everyone. My name is Ava Harris, and today I'm going to be presenting my policy pitch on obesity and the High Obesity Program, or HOP. Obesity is a major public health issue affecting millions of Americans, particularly in rural areas. Our goal today is to highlight the impact of obesity, explain how the HOP works, and discuss ways to strengthen its outcomes. Let's dive in. Let's start by looking at why obesity is such a critical issue. In the US, about one-third of adults and one-sixth of children are affected by obesity. The numbers are alarming, but even more concerning are the long-term effects. Childhood obesity, for example, often sets the stage for chronic diseases like diabetes, cardiovascular disease, and even cancer later in life. Beyond the physical health challenges, obesity reduces life expectancy, affects quality of life, and limits employment opportunities. Social stigma compounds the problem, making it harder for people to seek help. But this isn't just about individuals. It's a community issue. Obesity contributes to over $173 billion in annual healthcare costs. Addressing this requires comprehensive programs that tackle root causes, such as access to unhealthy foods, sedentary lifestyles, and social barriers to healthcare. So, what defines obesity? The World Health Organization describes it as an excessive fat accumulation that harms health. They use BMI as a measure. A BMI over 25 considered overweight, and over 30 is classified as obese. This isn't just about numbers. Obesity dramatically increases the risk of chronic diseases like hypertension and stroke. It also adds strain to our healthcare system. This is why public health interventions, like the HOP, are so critical to reversing these trends. Social barriers are a huge part of the problem. Did you know that people with obesity are less likely to seek medical care due to stigma and discrimination? For example, women with obesity often avoid gynecological screenings, which can lead to delayed cancer diagnoses. And in rural areas, limited access to health care makes matters even worse. These barriers reduce quality of life and contribute to persistent health disparities. Addressing obesity isn't just about promoting healthy eating, it's about removing these barriers, ensuring that everyone has the tools and resources they need to live healthier lives. This is where the High Obesity Program, or HOP, comes in. Launched by the CDC, the program focuses on counties where 40% or more of the adults have obesity, most of them being in rural areas. The program is funded through partnerships with 16 universities, which are tasked with implementing community-based interventions. These interventions focus on three main strategies: promoting nutrition, encouraging physical activity, and providing education about healthy lifestyles. HOP is a unique program because it's not one size fits all. It collaborates with local health departments and community organizations to tailor interventions to the specific needs of each community. So what does the HOP do? It improves access to healthy foods. For example, in food deserts, the program helps stock small stores with fresh fruits, vegetables, and low-fat dairy products. Farmers markets and community gardens are also a big part of this effort. Second, the HOP promotes physical activity by creating walking trails and improving sidewalks. These small changes make it easier and safer for people to stay active. Lastly, HOP focuses on education and policy. It supports long-term changes in the health environment by educating communities about nutrition and advocating for policies that prioritize public health. For example, HOP interventions have been credited with increasing fruit and vegetable intake by 5% in some areas. So, how is the HOP success measured? The program uses a mix of data collection methods, including surveys, community health records, and interviews. These evaluations track obesity rates, dietary habits, and physical activity over time. The results are modest but promising improvements. In some counties, obesity rates have decreased slightly, while access to healthy food and opportunities for physical activity have significantly improved. However, these successes are uneven. Some rural areas face challenges like limited funding and infrastructure, which make it harder to sustain that progress. The findings reveal both success and ongoing challenges. Counties participating in the HOP have seen an increase in healthy behaviors like eating more fruits and vegetables and being more physically active. Infrastructure improvements, such as walking trails and farmers markets, have played a huge role, but disparities remain. Some areas struggle with engagement and sustainability, which underscores the need for consistent funding and strong local leadership. So, what do the communities themselves think? Feedback has been overwhelmingly positive in areas where the program has been implemented successfully. People appreciate having access to affordable, fresh produce and safe spaces for physical activity. But the catch is sustainability. Many community members worry about what will happen when the funding ends, because without that continued support, the changes could fade and it could all be for nothing. That's why local involvement is so important. Communities with strong local leadership tend to have higher participation rates and better outcomes. Building a sense of ownership is key to making these changes last. So the HOP compares to other obesity programs like SNAP-Ed, and Let's Move. Those programs also focus on healthy eating and physical activity, but often target broader populations, including urban areas. What sets the HOP apart is its focus on rural, high obesity counties and its partnership model with the universities. This allows for tailored community-driven initiatives that address the unique challenges of rural areas. However, to truly maximize its impact, HOP needs to address systematic barriers like poverty and healthcare access. To wrap things up, the high obesity program has shown that the community-based interventions can make a real difference, but there's obviously more work to do. Policymakers need to prioritize long-term funding, community engagement, and strategies that address the root causes of obesity. We believe that with sustained support, HOP can continue to transform these rural communities, promoting health and reducing disparities. Thank you everyone for your time, and if you'd like to explore the references, they're right here for you to see.